Welcome, everyone, to Emerge Workplace. My name is Matt Ball, Vice President and Head of Workplace Market Development at the Financial Health Network. And on behalf of the entire team, I want to thank you for taking time to come sit with us today and to really dive deep into an emerging and important topic. Over the next 2 hours, we're going to explore the strategies, solutions, and insights that address the financial health challenges of frontline workers. Our focus ultimately is to continue to highlight the humanity and dignity of all workers, and to bring to the forefront opportunities to improve financial health for all, including those that are working on the front lines. The last 2+ years have been nothing short of extraordinary. Many of the issues that were bubbling below the surface have been exacerbated and brought to the forefront over the last 2 years. Work in the workplace seem to be undergoing tremendous change and transformation. And with that brings a lot of opportunity to reimagine the bargain we strike with the workforce, how we can engage more workers to prosper and thrive in our work environments. Last year, we saw in our Pulse survey that about 2/3 of the US population is not financially healthy. What this means is that the financially unhealthy are not in the workforce, they are the workforce. We are all in a position to help influence and make work and workplace a more prosperous, equitable, and financially healthy environment. We've got a great lineup of sessions today. They're going to dive into all of these themes, from building equitable workplaces to living wage tools that can help drive outcomes in a positive way for individuals, to building emergency savings for frontline workers. And just as important, bringing the voice of the frontline workers to the forefront, committing to a deep act of listening and understanding the unique challenges that workers face, especially those that are in the front lines. Of course, none of this would be possible without the generous support of our sponsors. So I want to take a moment just to thank them. Our foundation level sponsor, Prudential Financial, our gold level sponsor, Bank of America, our silver level sponsors, MasterCard Center for Inclusive Growth and PayPal, and our bronze level sponsors, DailyPay, Fifth Third Bank, Opportune, Members Development Company, and the National Credit Union Foundation. We sincerely appreciate your support, and none of this would be possible without it. By now, I expect you've all become quite familiar with the way that these virtual meetings go, but a few housekeeping items just to remind you. We do have a Q&A feature and a chat function on the right-hand side of your screen. Please use that throughout the session. That's a great way to capture your thoughts and feedback. We will do our very best to answer as many questions as we can within each session, but because of time, we just may not be able to get to them all. If you go scroll all the way down to the bottom of your screen, you'll see a resource page. This is where we have links to content, schedules, and all the material you'll need in order to follow along if you so choose. Closed captioning is available, so please see the bottom of the window to access this feature. If you have any tech questions during this time, we're all tech experts by now at this point to one degree or another, but there is a chat bubble at the bottom of the screen where you can access technical support. All right, let's get things kicked off. We've got a great first session. We've brought together 3 experts in the space who are going to really explore how benefits and total reward strategies can foster more equitable financial health outcomes across the workforce. Thank you.
Welcome, everyone, to the Building Equitable Workplaces session. I'm Ashley Marchand-Orme, Director of Corporate Equity at Just Capital, which is a nonprofit that develops research, rankings, indexes, and data-driven tools to help measure and improve corporate performance in the stakeholder economy. The last several years have changed our lives, from the way we work and the expectations we have of our employers to the mainstream nature of conversations about equity and racial reckonings. Employers are being called to think about benefits and other workplace rewards in a way that focuses on increasing equity across their workforce. Joining me today to discuss how they're thinking about benefits and other workplace rewards are 2 fantastic panelists. Felicia Chang is the Director of Global Benefits at Salesforce. She looks after a team whose work includes addressing issues of financial wellness, mental health, caregiving, and family benefits. Sarah Kay is the Vice President of Inclusive Solutions at Prudential Financial. She leads strategic philanthropy, business-aligned partnerships, and employee engagement programs to expand work and wealth opportunities and strengthen communities. Felicia and Sarah, thank you both so much for being part of this conversation today. Let's just dive right in. And maybe Felicia, I'll start with you. How is your company thinking about equity with regard to your employees or workforce, specifically in the domain of their financial health outcomes?
Thank you, Ashley, and thanks for having us. So financial health is really intersected with all parts of well-being, and I think it starts with recognizing that and then building towards an understanding of our employee experiences together so we can support the moments that matter for them. In my space and benefits, it's really recognizing, that financial education is really important and providing our employees with the education and also financial coaching and advising at the individual level to support where they are in their journey. But then it's also intersecting that with understanding, other needs that they may have, such as caregiving, whether it's for children, little one, or older adults. So we have a suite of family benefits that supports our employees, and we look after things like the paid parental leave. And in addition, Salesforce is really passionate about supporting equal pay for equal work.
And Sarah, maybe I'll go to you next. How's your company thinking about equity, especially when it comes to financial health outcomes?
Definitely. I will echo everything that Felicia said and add a few more things in the sense of, we know that American financial security is at a very fragile point, particularly everything that's happened over the last 2 years with the pandemic. Even pre-pandemic, we knew that 60% of Americans didn't have $500 in emergency savings. And there's decades of research when employees are less stressed at work, financially stressed at work, there's higher productivity, higher engagement, higher customer satisfaction. So we know that it goes all hand in hand. And as employers, we really need to focus on how do we build equitable workplaces that are providing comprehensive benefits that's really looking at the emotional, physical, and financial health of the employee, and really making a lot of efforts to invest in our employees to really ensure that they are, living thriving lives and they have access to resources and supports that can really improve their financial health. And as a benefits provider of life insurance, retirement products, we have a whole suite of financial wellness products that we've been providing our customers and clients, and making sure that that's being matched for our own employees, the employees who are creating and distributing these products, and really making sure that they have the access to the resources, and also looking at the equitable access to that, what is most important for different demographics and populations, and how they're accessing and utilizing them.
And Sarah, maybe I'll stick with you first for this next question. Can you share any specific programs or some more details about the initiatives within your total rewards or benefits where you have applied an equity lens? Maybe talk to us about the results and maybe what some of the challenges were that you faced.
Definitely. So we do an annual survey that looks at what we call our health quotient survey and also our employee quotient survey, just to get an understanding of how employees are feeling about their benefits. What are they utilizing? We look at utilization rates. And a few things that we've implemented. One that's been in place since almost the founding of the company is this tiered pricing structure. So we have different compensation levels in terms of if you're a manager, a director, a VP, and higher. And the higher your director level, position level is, the more that you will pay for healthcare premiums. So really look at the socioeconomic equity status of making sure that employees who are not making as high salaries as some of our senior leaders are paying less for their healthcare premiums and what they can put into their healthcare spending plans. In addition, we just recently announced a new program after doing a total rewards survey to get employee feedback. And we're calling it a wellness program, a reimbursement wellness program, where employees have access to $1,000 for anything that they consider to be improving their well-being. And that could be around physical, emotional, financial. And so you could use those dollars to pay for your gym membership, to buy a Peloton bike, but also to pay for massages, to pay off your college student loan debt, to look at all the different ways that you decide for your own self. And that's what we heard loud and clear in our surveys, that employees want to make the decisions, because we used to have, here's how much you can allocate for this program versus this program. And we heard loud and clear from our employees that they want to decide for themselves what is most important and what's going to help improve their well-being. And so those are some of the examples where we're listening to our employees and really trying to find programs that are meeting people's needs at any, whether it be income level, demographic, or population.
Great. And Felicia, let's talk a little bit about Salesforce. Can you maybe share some of the specific programs within your total rewards or benefits where you've applied an equity lens?
Sure. So we're pretty proud of our benefits, and we know there's a long road to go ahead. So we're continue building on it. In the past year, more recently, we offered a global gender inclusive benefit package for our transgender and non-binary employees that supports their financial and emotional changes. So in that package, we offer things like gender affirmation medical reimbursement. We've always had some of this in the US, but we know and recognize how important it is around the world. So we've extended it globally, reimbursements for gender affirmation and gender affirmation leave, so people can take the time that they need to recover. But we also understand their experiences. So we've offered things like a wardrobe reimbursement, support for legal fees, and counseling services. What we're also looking to do this year is to roll out doula coverage for maternity to support the maternity process, because we know from the CDC that pregnancy-related death is 3 to 4 times as high for Black women as it is for white women. So we want to be able to support their maternity management program a little bit more and provide them that access to doulas. Some other things that we've always done is we're very mindful of the vendors we select. So whether it's through healthcare navigation, or financial coaching or mental health, we look for vendors who have a strong stance in DEI and are very culturally sensitive. And I think that's something we could all do in our RFPs. I mean, in my space and benefits, you're working with partners and vendor partners all the time. And so it's a great conversation to have at the very beginning of your relationship to see who are the people that are talking with your employees on a day-to-day basis, who are the people that are supporting those services to your employees.
Well, I appreciate that answer from both of you. And I'll just underline, Sarah, I think what I heard that was fascinating from your answer was just that focus on employee choice, giving the employees the ability to make decisions about where they want to take advantage of benefits. And of course, Felicia at Salesforce, that tying in equity with inclusion and being really inclusive in terms of things like your gender diverse employees. So thanks to both of you for sharing that. I'd love to shift a little bit to talking about how you inform your decisions about benefits, specifically when it comes to equity. What data are you using to inform those decisions, and how are you leaning on your workforce to help make those decisions about your benefits? Maybe Felicia, we'll start with you here.
Yeah, and Ashley, you mentioned some of the challenges too, and data is really hard to get around this space, right? And it's voluntary, it's a lot of self-ID data, and we want to be respectful to data privacy. So I think data is a challenging one, but that doesn't stop us from listening to our employees. So we really lean there as a company, and not just we do a lot of surveys, and the surveys do a really great job of informing our benefits, but we also know that there are underrepresented groups that you kind of may overlook if you looked at an overall survey. So we talk to our ERGs a lot, and we partner with our ERGs a lot. And we talk to our employees almost every day. So I would say we start with practicing deep listening, understanding what they need. That's kind of how the gender inclusive benefits that I alluded to earlier came about. And it's really from deeply listening to a group of employees.
Yeah. Sarah, anything that you'd like to add there about how you all are thinking about informing your decisions based on data or employee feedback?
Yeah, it's similar to what Felicia said. We look at our survey data in terms of, as I mentioned, the health and employee quotient. We ask them, how do you feel about your benefits? Which benefits do you find most useful? What are you financially most stressed about? We knew debt reduction is always number one that comes through. But it is challenging because it is, employees have to want to provide that data. So it's not that we have the whole set, but we try to get as many employees engaged in that survey process. Then we actually look at the utilization of the benefits. So we know what percentage of our employees are utilizing benefits that range anything from, it could be our healthcare as big as that, or we provide housing counseling counseling, debt counseling, and we use third-party vendors for that. And we look at the percentage of usage on that. And are they taking additional steps? Obviously, there is quite a firewall. We do not know anything about their finances because they're having that conversation with the vendor. But we want to know if they're actually utilizing and taking the action steps to help them with whatever stressors they may have. So that's all combined and thinking through that, making sure that we're providing a suite of benefits, because we have, as similar to Felicia at Salesforce, we work with, we call them business resource groups, so BRGs, but ERG is the same thing. And we know that in certain business groups, they value certain benefits more than another BRG. And so it's really important to make sure that you're providing the full suite and that you're giving equal attention in marketing, but also distribution, because one BRG may value self-help, career planning, whereas another one values much more healthcare. And we know that there's a generational divide as well, too, that our older workforce tends to value benefits more than our younger generation. And that may be due all of us getting additional health issues as we get older. But, just really making sure that people have access to the information and the suite of support services that we can provide for them.
This is great. And I want to stay on this thread, but I'll pause here for a second and just remind our attendees that we will be taking questions at the end of this session. So if you have a question that's come to mind, feel free to drop that in the chat for us to take a look at. Would love to hear, Felicia, either from you or Sarah, a little bit more on sort of deciding on that mix of benefits. We've talked about how data and employees inform those decisions, but particularly when you're thinking about, launching or sunsetting benefits, what are some of the decision points that come in, particularly when we're thinking about equity?
Do you want me to start? So yeah, for us, it's utilizing all of the same data before hearing from employees, it's hearing from our employees using the data that we're receiving on Access, but then also always staying on top of the trends and innovations that are happening out in the marketplace, because we know that we're not going to, create everything or develop every product, but we want to learn from best practices out there. We also, as a benefits provider, we hear from our employer clients what their employees are needing and asking for. We see what the usage rate is when people are going into our financial wellness portal, using our financial wellness assessment. So we take all of that aggregate data to make sure that we're providing this full suite. And, oftentimes sometimes you want to make sure that we are providing the full suite, but then sometimes when you're providing the full suite, people are like, there are too many benefits and I don't know how to navigate it. So it's also really making sure that we're being clear with where people can look for information, how they know the pathways to the different support services, but listening, and most importantly, to the employee community.
Yeah, I mean, exactly what Sarah said. And we're not afraid to try new things, new benefits, new ideas, new pilots. And it's really just trying to figure out what is most impactful to our employees. So, utilization is one point of data. Sometimes it's important in a program and sometimes it's not, right? Depending on the total, eligible population of that benefit. So it's a mixture of a whole bunch of data to really inform us if it's been impactful.
Great. And Sarah, maybe I'll send this next question your way first, which is, how do you and your HR and your diversity, equity, and inclusion departments work together, given the natural synergies that might exist in your strategies? What's worked well, or what would you like to see more of in terms of HR and the DEI office working together?
Yeah, and I think you guys did a great job, because Felicia's on the HR side. I am on what we call our inclusive solutions department that manages our inclusion and diversity efforts for the enterprise. And we work really closely with our HR colleagues, but not just even with HR, because, I keep saying this, but because we are a benefits provider, from also our, distribution, development, and product team, right? To think about holistically, how do we make sure that we are providing all the benefits, whether it's to our employees or to our clients and customers, that are looking at the whole and are looking at equitable access, equitable choice. And so we work closely in, helping. We manage the employee resource groups and at Prudential. It's through my department. And so working closely with HR when they want to survey employees or do focus groups, teasing the data together, doing an analysis of what's coming through in the access or interest rates or utilization. And so it's a very symbiotic relationship where we see ourselves as collaborators and really making sure that we're making the best choices for our employees.
Great. Felicia, anything to add from the HR side?
I think it's that it's so important to collaborate together. Our equality team teaches us so much, but we're the benefits experts, so it's a really good collaboration and brainstorming and kind of sharing ideas and also feedback from our employee group. So it's really critical.
Great. And I can see we already have an audience question. So let's pause and address that. The question is, gathering employee feedback is so important. What are your strategies or tips to increase employee responses to surveys that ask about their needs?
Yes, getting employee responses is always a difficult challenge, not just on the benefit side of things, but we try to do as much communications as possible at the enterprise-wide level, but then also in targeted groups with our employee resource groups. And so obviously there's a message that comes out from our Chief Human Resources Officer with every annual survey that it does, walking them through in terms of why it's important. We have an intranet site, so there's a page that's dedicated for people wanting to know additional information. But we're fully aware that many of our employees, get tons of emails and they may not look at that one. And so making sure that we're going to our employee resources groups, reminding them, having messages come out from our office as well too, because, especially when we do the total rewards survey, that has significant implications and changes and improvements. And I think that's a great way for employees to want to engage in the survey when they see changes, when they see improvements being made based on the feedback that they're given. And so it's always circling back afterwards to make sure that employees realize that because of your feedback, we did X, Y, Z. And so to really increase that and make sure that employees know that they really do have a voice in all of this.
Great, Felicia.
I love that, Sarah. It's definitely showcasing how we've utilized some of their feedback, so it doesn't feel like it's going in a black hole. But I would also say, the culture is really important, the culture and setting a really safe environment and a safe space for employees to share. These are usually very vulnerable topics, so I would start with that, just creating that safe space for our employees. I mean, equality is the center of everything we do at Salesforce. So we really believe it. I mean, we walk the walk. We do a lot of sensitivity training, cultural training, microaggression training, and just at the corporate level, we expect a lot of our managers to also understand that. So we're setting up an environment where it is important, and then leveraging that to really build on to those deep listening skills and hear from our ERGs and our employee base.
And would love to go back to something that we discussed a little bit earlier in the panel, which is that idea of how you think about the mix of benefits. It's paying attention, as we've said, to employees and thinking through how to get response rates higher for your workforce. One of the other things that was mentioned earlier was the idea of just sort of being aware of the trends in terms of benefits and rewards. And I'm curious to hear, maybe Felicia, we'll start with you about what are some of the ways that you see benefits or employee financial health issues evolving over the next coming years?
Oh gosh.
Crystal ball question, the one that
Well, it's definitely more important than ever. I mean, it's always been important, but I'm happy in the space that we're in because I feel like that the conversation is coming up everywhere, right? So I think there's so much more to it. But there's also a lot of financial health issues that are being uncovered. So I think we just kind of continue to, and there are a lot of vendors and benefit partners out there who are looking at the equity solutions. So there is a lot of opportunities in this space. I think it's staying abreast of it, being open-minded to trying some of these new programs and connecting it with kind of what we've been talking about, our employee feedback and survey results to really see what works for them and drives an impact.
Great. Sarah, anything to add there?
Yeah, I think we're seeing much more emphasis and focus on the financial health side of things. I think prior, maybe a decade ago, was really focused on the physical and mental issues or challenges. And now we're seeing the financial challenges, and they're all interconnected, right? If there is a health challenge that somebody's facing and you're incurring massive medical costs, that then bleeds into the financial health side of the challenges. And so Just Capital, Financial Health Network, and a few others have come together to create the Worker Financial Wellness Initiative, which is, taking companies who are either already invested in this space, wanting to do more to improve their employees' financial health. And, I said this at the top of the panel, which is I really do think COVID-19 has shed a lot of light in terms of the financial vulnerabilities that all American workers face. I mean, we saw millions of people filing for unemployment. And so really making sure that we are providing benefits that are equitable and that are looking at the whole of the person and not just one thing. And I think the other thing that we're seeing much more being recognized is that people tend to think financial challenges are only part of the low to moderate income individuals and it doesn't impact high wealth individuals. The size of the problem might be very different, but the income volatility is the same. Medical challenges, short-term emergencies, all of that is exactly the same and an even playing field for everyone. You know, I mentioned 60% of Americans don't have $500 in emergency savings. So there are so many things that need to be unpacked and really helping to think about what solutions work for all populations, but also, you know, looking at the differentiation between the demographics.
That's great. And we are just a minute or two from finishing our conversations, but I do want to pause and maybe hear from each of you one final takeaway that you want to make sure our attendees walk away with today. Maybe Felicia, we'll start with you.
I think it's important to recognize we have more power than we think we do in the roles that we play, you know, whether in HR or in equality teams within the companies or just as a corporation. And that we have the ability to push the marketplace, to change the marketplace, to push on legislation that is old, and our vendors too. And there are a lot of amazing vendors out there and business and benefit partners who are really passionate about equality and equity as well. And I sound like a broken record, but really listen to your employees. And it's okay to start small because we've done a lot of really small things and they compound and they kind of add together for some total amazing experiences. So it's okay to start small and you have more power than you think.
Great. Sarah?
Yeah, I would just double click on Felicia's point on the sense of listening to your employees, offering choice, giving them flexibility because they know their challenge is the best, but they need access to all the different types of support. So really making sure, you know, Felicia brought up a really great point that utilization is not everything. So we have some, you know, support services on the financial health side where it's less than 10% activation or utilization. That does not mean that that's not an important benefit that we need to continue to provide. So really making sure that you have a sweep of giving employees the choice and flexibility.
It's a great point. Great points from both of you. Well, that is all we have time for in this panel. Sarah and Felicia, it's been a pleasure. Thank you both so much for sharing those insights with us.
Thank you.
Thanks.
Wow, welcome everybody. Welcome back. What a great panel. What a wonderful way to start off the day. I mean, full disclosure, I think there are 3 folks on that call, on that panel that could all replace me as MC next year. Just a powerhouse group, really insightful. A couple of key takeaways that I really drew from that. One would be acting with intention. I think oftentimes we find ourselves thinking about diversity, equity, and inclusion, but maybe not coordinating or acting with the level of intention that this topic really desires. And so I thought that panel was a great conversation about how organizations can really think about and act with intention. We're going to transition to our next session. I think this session really is going to focus on living wage, recognizing that income is the essential building block of financial health. We look forward to hearing from our experts, really going to dive deeper into living wage, what it means, and how do organizations start to think about it. For the vast majority of people in this country, income is derived from their base wages. And so understanding the sufficiency and adequacy of those wages is really paramount in designing a financial health strategy for your workforce. This session is going to dive deep into that conversation and really look at how companies can start to explore adding, evolving, or contributing to a living wage approach for their frontline workers. Thank you.
Hi, everybody. My name is Sarah Kalik. I'm the Executive Director of the Good Jobs Institute, and I'm so thrilled to be here with you today to talk about living wages. Living wage is incredibly important for communities and for companies. The journalist and academic Matthew Desmond wrote a beautiful article in the New York Times a few years ago called "Dollars on the Margin," and it starts with, a living wage is an antidepressant. It's a sleep aid, a diet, a stress reliever. It's a contraceptive preventing teenage pregnancy. It prevents premature death. It shields children from neglect. On the flip side, low wages have been shown to drive poor physical and mental health outcomes and make it hard for families to plan for the future or live stable lives today. Many people can't save for a $400 emergency, never mind a house or education or retirement to pay rent. Some people can't feed their families. As I said, this is a crisis for our communities, but it's also a crisis for companies. When your teams live financially precarious, unstable lives, that's going to impact your business. People have to work 2 to 3 jobs who can't afford to fix a flat tire, may not be able to get to work on time, and when they're there, they may not be able to focus. One study found that people under financial stress had a bandwidth tax of 13 IQ points, and another found that nurses and truck drivers who are under more financial stress make more mistakes. Now, in this very tight COVID labor market, wages are rising rapidly. But how can employers really feel confident that these higher wages are actually sufficient for their workers to make ends meet? At the Good Jobs Institute, we do a living wage assessment with every company that we work with, and most have never done this before, and it's really illuminating. Living wage assessments are also key to the Worker Financial Wellness Initiative, a joint project of Just Capital, PayPal, the Financial Health Network, and Good Jobs Institute that encourages the largest companies in the US to do worker financial assessments. We're actually proud that Verizon is a member. This panel will explore the why and the how of living wage assessments. I'm incredibly thrilled that we have 2 leaders on this panel who are going to be able to tell us all about how they do this in the field. We have Michelle Murray, the Chief Executive Officer of Living Wage for Us, and Deborah Cimino, Director of Compensation for Verizon. So I'm going to turn it right over to you. Michelle, I would love for you to tell us a little bit about yourself and Living Wages for Us, and what motivates the companies who are going through your living wage certification process?
Absolutely. Well, I'm really happy to be here and to be able to talk about living wage for us and about living wages and the importance of those. I've been working on the issue of living wage almost exclusively for about a decade now, and formerly in sort of the global supply chain space, and really realized that here in the US, often we aren't assessing living wages against own employees. Companies that might have very involved processes and supply chains haven't taken a look about whether or not they are covering a living wage for all of their own workers, where they have a lot of control. So we formed Living Wage for Us, which looks at total remuneration and assessing benefits as well as all forms of pay that a worker can depend on, to see how that covers the cost of living for workers across the spectrum. And one of the things that we really do in sort of analyzing that is we're able to get at some of the motivations of employers, like you asked about. A lot of times that's about recruitment, and there's a question about, well, we know we need to raise wages to compete right now, but we don't know where is the right point. Do we just throw a dart against the wall, or do we actually have a target that we understand what it means? And so we're very based on clear evidence and research and very detailed analysis, so that we would understand, for example, what is your specific healthcare benefit you're offering? How much is that saving a worker from what they would spend on the open market? Let's look at the other benefits you're offering. How much are you actually saving a worker towards achieving a decent living for themselves? And the implications of that are that we're going to remove the barriers, we're going to create the incentives so that a living wage is better for workers, for employers, for communities, and really for us, which is where the Living Wage for Us comes from, is we're always looking through all of those lenses of how do we make this mutually beneficial, increase productivity, make sure workers are benefiting, also increase retention, and have huge recruitment benefits. We're really designed to make sure employers understand the most affordable way to get a decent living from a human rights lens for their workers.
Fantastic, thank you. And great points there. Many companies for years have been focused on supply chain, human rights issues, but maybe haven't looked internally. And the living wage assessment is a great way to do that. And one company that has done that is Verizon. So Deborah, I'd love to turn it over to you to talk a little bit about your role at Verizon and why Verizon decided to do an internal living wage assessment.
Sure. So first off, thank you so much for having me today. This is a topic I'm uber passionate about. A little bit about me. I lead Verizon's broad-based compensation team that supports our consumer, business, and network and technology groups. My main focus is to make sure we offer the right packages to reward our most important assets, which are our people. Resources are prioritized around analyzing market data, looking at salary surveys, and overall compensation trends. My team and I work lockstep with our HR partners and the business leaders to really make sure that our compensation strategy aligns with our business priorities. Prior to this, my career was spent as an HR business partner, and then I also spent time in IT, finance, and operational roles across different types of industries. As far as why did Verizon decide to do an internal wage assessment? So this isn't the first time we've done this, although this year has been one of the most critical due to an increase in talent attraction and retention issues. You know, workers are taking this time to rethink their careers. They're thinking about work-life balance, their long-term goals, and overall their working conditions, right? Where do they want to work? How do they want to work? And so the pandemic has significantly influenced inflation. You know, employers are raising pay to attract and retain talent. Inflation has reached a high of 7%. It's still going. And many of our revenue generating roles at Verizon, our critical roles at Verizon, are all frontline. So these are the folks that are in our stores. They help customers over the phone. They go into homes for installation, support, and maintenance. And while so many other roles pivoted to a work from home model, many of our frontline roles were not able to, which makes it even more complex from an attraction retention standpoint. I'm sure everyone has seen the media reporting how companies are raising their starting rates of pay. You know, the big question we ask ourselves is, how do we really know what that right number is? You know, market data can have a lag. You know, sometimes anecdotal data tells us something different. It's just not always telling us the full story. And so the living wage assessment helps us have the confidence that we're paying our talent not only to live, but really to thrive. From affordable benefits packages to the opportunities for continued education, we really want our employees to be supported financially, professionally, and personally. And the living wage assessment helps us to reinforce our commitment to our employees.
I love that. And I'm hearing from both of you the incredible urgency around this, both for your companies to be able to retain and hire, to be differentiated and be able to compete, but also for your team members, right? This is incredibly important for them to make sure that they can make ends meet. So there's the urgency, the why. Now we get to the how. There are so many approaches to assessing a living wage. So would love to dig in with both of you, starting with Michelle. How do you measure a living wage, and what challenges have you encountered as you've done this here in the US?
Absolutely. So, you know, coming into this from having a global point of view on living wages and working with a large number of multinational companies that I know are working on this issue across global operations, what we really wanted to do is create a living wage estimation methodology that aligned with the global gold standards. That if a company is working in a number of countries in their supply chain or on operations in other countries, we are going to align what's going in the US conceptually around living wages with what is being done there. So certain things like we have designed a product specifically for the use of living wage employers. It makes it a little bit different than calculators like MIT's, for example, that were designed for different purposes in mind, you know, more of a policy moving piece, or for individuals to see with their family makeup how much they would need to make in a specific area to really afford a decent living there. We've often heard from employers, well, I don't know what kind of family to select. I don't know what, you know, I don't know which direction to go in. And what we've done at Living Wage for us, by aligning with that global standard, is take sort of what is the accepted methodology for estimating a family size and apply that in the US so that companies have one clear figure to work towards. And that for us is a family of 4, but with 1 3/4 workers in that family. So we don't expect the living wage to be earned by one worker to support the entirety of the family. We do statistical analysis to get there. But one of the other things that we're sort of including in that global alignment goes back to some of the stuff, Sarah, that you mentioned earlier in your intro, like families not being able to afford unexpected cost of $400 per month. We include a margin for unexpected events. That means that when your employee's car breaks down, they're able to find a way to pay for that and still come to work instead of suddenly find out, I can't pay to even get this fixed and I'm going to have to miss days of work, right? There's a lot of issues that come from being bombarded by not being able to pay for sort of basic expenses. So we include those in there. And really what we're looking at as well is this as a long-term goal. When you're talking about recruiting employees that are coming on, there's a lot of employers that are offering bonuses for signing bonuses, right? Right now is a lot of, we need workers, signing bonus. Well, workers are able to see through, is this going to be a one-time thing where I'm going to come on, take a signing bonus, and I'm out the door in a little while because they're not really thinking about treating me well long-term as we sort of reposition, or is this something that's a long-term commitment? And so what we offer is living wage certification so that employers are able to show and signal to potential employees as well as consumers and investors that are interested in the S of ESG, which we talk to a lot, that we are committed to the concept of living wage. We're having a third party certify that we're paying that. Our claims mean something. And that's really meaningful in recruitment. And we've seen employers that say it drastically changed their ability to bring in high quality candidates that stayed in through the entire process because they knew, oh, these numbers are updated annually. It's not just something you're responding to the moment, but every year you're going to make sure to keep up with my cost of living changes. And that kind of assurance really goes far. And that's something that we're providing a bit differently than MIT. I think the last thing, and I know we're short on time, but we analyze total remuneration. So we understand that in the US, not accounting for benefits doesn't always make sense, right? And benefits have a wide range. So, MIT does imagine, and they do an excellent job at what they do imagine that health insurance is already provided and sort of take a general figure for that. What we're imagining is we take from the marketplaces the actual cost of healthcare, and we include things like public policy and what subsidies exist right now so that employers can see how policies differentiate and make a difference on what the living wage is. And then we look at a specific plan. If you provide health insurance and you have your employees pay 80% of it, that's a lot different in terms of what you're saving them than someone who provides it and has them pay 20% of it. And you should be getting credit for that if you're one of those that's covering the bigger cost. So we go category by category, commuting zone by commuting zone, and really assess what exactly are you saving your worker to make sure you have a clear understanding of how you're achieving a living wage for all of them.
Thanks, Michelle. And a couple things to pull from that. One, this is detailed and you've got to figure out what the cost of living is, but there's tools out there to help you. And just figuring out the cost of living is not enough, right? So you don't want someone to be at a subsistence wage. You want someone to be able to save and be able to have some flexibility. And that's something I think PayPal did really well. They created their own kind of metric called net disposable income, which created that cushion, which certainly is a key part of financial health. Fantastic. So turning it over to Deborah, what approach did Verizon take and why did you choose this approach? Who needed to be involved and any challenges that you found along the way?
Sure. So a little bit behind the scenes. So we prioritized efforts around our entry-level roles. So these are those frontline roles I was talking about before. They interface directly with our customers. So we measured income by looking at employee total direct compensation. So this would include base salary, variable compensation, any long-term incentives. We also incorporated the cost of benefits. So this would be medical, dental, vision into the analysis. We excluded overtime and premium pay, and we used tenure as a proxy for when an employee may add a child to their company or to their family. We determined estimated cost of living by using MIT's living wage calculator, which assumes the cost of living in a community or region based on typical expenses and what residents need to meet the minimum standards of living. Next, we compared the MIT's living wage calculator required annual income before taxes to each employee's total direct compensation. If the employee's total direct compensation was above the required annual income before taxes, we assumed additional taxes on top of that to represent the excess income. We also validated that established career paths deliver meaningful net discretionary income even as families grow. As far as challenges, it was a challenge to get comfortable with the data and the assumptions. Again, the data doesn't always tell us the full story, and we're making a lot of assumptions. It's really hard to assume when and if employees will have children. How many will they have? And, inflation has certainly been a wild card. We just don't know where it's going. And so since the work was housed within our team, which is the compensation and benefits team, we didn't need buy-in from the business just to do the analysis. We view this as part of our core responsibility to our employees. And since this wasn't the first time we completed it, we already had buy-in to run the analysis. But as far as recommendations, so next steps in taking action, those require significant buy-in from the business leaders and certainly from our finance partners. And since roles span across multiple business units, what we do in one function, it has to make sense in the other. So it's not this siloed approach. And so that cross business unit stakeholdering can really be a challenge.
Absolutely. Absolutely. And we've got some great questions coming in from the group. So I might actually go to one right now because it's about execution. What's the typical time frame and cost to conduct a living wage assessment?
So I can hit that first from a living wage for us point of view. We've put together a online tool to make this as easy as possible, where you can come in and just put in your benefits packages and your pay at different locations. And we only look at lowest potential pay, so starting wages. We're really looking at the floor rather than having to put in every single employee. And for us, that could, if you have someone dedicated to put it in, you can get it done in a day. We're automatically going to go through the outcome with you. And depending, we have a sliding scale of fees. So depending on the size of the employer, in terms of annual revenues in the US, it could cost between $250 to get it done to a maximum of $10,000 to get it done, which really compared to doing it internally, and I'd be curious to hear from Verizon on how that is probably a lot cheaper than doing it yourself. And it's going to give you a lot of detail behind that.
Fantastic. So yes, I think you can do this externally. You can also do it internally, and that is with your data team. And it depends a lot on your HR systems, how long it will take. But this is not a hugely heavy lift. This is something that every company can do, and there are definitely tools out there. So really encourage you to check out the tools for living wage. For us, we have a living wage assessment tool on our website as well. You can do this. So great question. Before we get to a few more wonderful questions from the audience, wanted to ask you both about impact. So Michelle, you're helping companies do this living wage assessment. What are they learning? What are they doing with this?
Yeah. So, we've worked with companies that thought that they would, okay, we're committed to this, we understand this, but we're going to need to freeze upper management salaries because we need to somehow address the issue of this cost. And there was always this talking of this as a cost. And really what is starting to come out is not a cost, it's an investment that pays. And I think that's really what's key is companies that are taking the leap of faith are actually seeing revenues go up and are actually seeing profits increase because they're paying a living wage. So, there's this sort of key push and pull of why would companies do this? This makes basic business sense, right? It's not only, I would love it if everyone said we want it for our workers, we want them to have, that's the right reason, but it's also fine to say this is just smart business. It just makes sense to make sure that your workers are able to come to work every day and able to afford the basics that they need in life so that you have a more sustainable environment for them.
Absolutely. And we've seen that quite a bit over the last year where some companies can't even open regular hours because they can't find folks. So there's a real business case for this. And it's important as you're building urgency to dig in and think about the cost of turnover, both direct, but also indirect in terms of productivity and service levels and operational excellence. Fantastic. So Deborah, similar question to you. You've done this living wage assessment. Has Verizon taken any actions as a result of your efforts to date? What are your next steps?
Yeah, so we continue to keep a real strong pulse on living wage, especially because the market is still so volatile. You know, we're looking at opportunities to make our total rewards package even more competitive. So we don't view this as an annual cycle, a one-time thing. We're going to keep on doing this throughout the year. And so we did this internal assessment using in-house resources. And actually now we're in the process of launching a total remuneration study to help us benchmark areas including base compensation, variable compensation, broad-based equity programs, recognition, retention, work-life balance, benefits, just to name a few. You know, we're really proud of the work that we do in-house, but we also want that third-party validation, especially from companies that specialize this, right? This is their wheelhouse. And so it's really good to get that objective viewpoint as well.
Absolutely. Excellent. Well, we have a couple of questions coming in from the audience. And the first one is really important. What role does wage compression play when thinking about a living wage? And I know a lot of the companies we work with are facing this. They've raised starting wages quite significantly over the last couple of years. And that can be challenging for some of your more senior team members to make sure that they're also making a wage that is fair. So either one of you want to tackle that one.
Yeah, we have different companies that are approaching this differently. Some have realized they have large gaps between sort of frontline worker entry wages and those in higher managerial positions. And so really when they looked at it, whether those gaps are driven by benefits differences or wages or both, they've been worried about compression and then realized, oh, even if we bring our bottom up, there's still a significant difference between, you know, maybe what our management team is earning in this specific company. So once you get the data in front of you, it makes it much easier to understand what's going on. So that's why the assessment is really key. But two, others are thinking about how do we keep our differentials? And what it means is that we're having some impact a little bit beyond, pushing out beyond those that might be below a living wage, where they're seeing a little bit of an increase as well. And really, that also makes sense when we're looking at times of high inflation. This is a time where already those people, if they stay consistent, are really working at a loss. So thinking about having to push them up, you're addressing two issues, right? You're addressing compression and keeping differentials, but you're also addressing the fact that we really should adjust for the cost of living increases that have gone on across the country with inflation.
Absolutely. Fantastic. When we do living wage assessments, we will do sort of everyone, across a company, but we may also do it by tenure. There's lots of ways to cut this data. So dive in deep, and that will tell you a lot of stories as well. Another question, is there a role for unions within the concept of a living wage?
I personally would say absolutely. We have gone through a range of stakeholder consultations to pull together our standard and our guidance and our certification system, as well as our methodology. And unions were a big voice that were necessary to, or not just necessary, desirable to have in that conversation, and have been in that conversation. And having worked on this globally, what I found is that a living wage becomes oftentimes a collective bargaining tool that unions can use, right? Is saying we have this data that says this is what it costs from a human rights lens to live at a basic level of decency, and that data should be available. There's also the proven case from voluntary companies that say we want to be a living wage employer, to say that this is possible, to counter the, oh no, that would cost too much, it'd put us out of business, with the stories of actually it makes you do better. So there, actually there were huge business benefits to this. And I think that becomes a very valuable negotiating tool for unions. And ideally we would be able to have more information to continually feed into unions. And I think there's one, thing that to add in that living wage assessments shed light on. In our case, we often hear that many of my employees don't have kids, so why would I have to pay for childcare? Well, we're seeing women disproportionately impacted by the fact that they can't go to work because they don't have childcare or they can't afford childcare. We saw that massively during COVID. So it starts to affect a lot of other issues that unions might be looking at, like gender equity lenses. Really, are women and people of color that are in frontline positions making less? Are we going to think about that? Are they being able to afford childcare? And they start being able to look at benefits like, hey, if we provide childcare to 100% of our employees and reimbursements, if only 10% 100% take advantage of that, we're covering a huge need for all of our workers without necessarily having to invest as much money as it would cost for everyone. So there's interesting things that come into play.
Fantastic. We just have about a minute left. I'd love to hear from both of you, starting with Deborah. What's your advice or biggest takeaway to a company that's considering diving into a living wage assessment or offering a living wage?
Yeah, absolutely do it. You know, you need that peace of mind that your employees are set up to thrive, especially nowadays. We're so hyper focused on inflation. And although it's not required by law, it's really a vital benchmark to make sure that people can meet their basic needs and thrive. And so I know many companies worry that a living wage study will reveal a pay gap that's tough to close, but you need to have this awareness and realize that these are really the first steps on the employer's journey to paying an acceptable living wage for their employees. And, you know, talking about resources, there's tons of resources out there, right? So you can do the work in-house. On the other hand, you know, there are third parties available that can help, certainly if a company wants to outsource it. And so, you know, just thinking about this in general, this really should become BAU work in support of creating and sustaining a competitive total rewards program.
Thanks. And Michelle, you got about 20 seconds. Your nugget of advice.
Well, then I'll just here on that, get the assessment done and just say, you know, we separate the assessment application from actual certification so that employers won't be dissuaded and think they're committing all the way to the end by getting the assessment done. Just get it done and get the information. Then you can work through the internal processes to make a decision.
Fantastic. And there are great communities of practice like Living Wage for Us and also the Worker Financial Wellness Initiative, which again, the Financial Health Network has been such an incredible part of. Check us out, join. There are tons of tools to be able to do this. And knowing where your workers stand really can help you drive better jobs and better business. Thank you very much, everybody.
Welcome back, everybody, and what a wonderful panel. Thank you to Sarah, Michelle, and Deborah for really providing a lot of practical insight that I think organizations can use as they evolve their living wage strategy. You know, one of the things that really stood out to me in that session was the connection between viewing the workforce as the most important asset. And if you're a nerd like me and you read proxy statements, you'll see that there's hardly a company in the country that is not manifesting that sentiment. And I really appreciated Michelle's through line to that about how viewing increasing wages and really thinking about the benefits to your workforce is actually an investment in that asset. And we're continuing to see more organizations, particularly as the S and ESG evolves, really bringing to the forefront, matching the sentiments they're putting into the market and the actions that truly align with that. So very exciting stuff. Definitely things we want to continue to pay attention to. Now, we've all heard the proverb, nothing is certain except death and taxes. And this proverb was really designed to highlight that one cannot avoid the inevitable. I would suggest that we should amend that proverb to say nothing is certain except death, taxes, and unexpected financial shock. We've heard from all of our panels today about the lack of short-term savings that most Americans have, whether it's an unexpected or surprise bill, a car repair, or some other unknown or unexpected financial obligation. Everyone eventually is going to face an emerging financial challenge, which is the necessity underlying the role of emergency savings programs. In this session, you're going to hear from two of our partners and experts from BlackRock's Emergency Savings Initiative on successful approaches and lessons learned through delivering emergency savings solutions to frontline workers. Thank you.
Thanks to the Financial Health Network for inviting us to speak today, and to Qantas for joining me for this conversation. My name is Brian Gilmore, and I'm a director at Commonwealth. We're a national nonprofit that is committed to building financial security and opportunity for all in the US. As part of BlackRock's Emergency Savings Initiative, which is a multi-year philanthropic effort led by Commonwealth Financial Health Network and Common Sense Lab, we've engaged many private sector partners to research, pilot, and scale innovative solutions to address the emergency savings crisis in the US. When the initiative officially started prior to the pandemic, much of the work has been in response to the impacts of the pandemic, including an increased awareness of the importance of emergency savings to financial security and the important role that employers play in addressing that challenge, particularly for frontline workers. As even more commerce shifted online during the pandemic, workers at logistics companies like UPS played a critical role in keeping the broader economy active and were some of the most important frontline workers, ensuring households had continued access to essential goods and services they needed, like food, medical supplies, and other necessities. Commonwealth was fortunate to be able to partner with UPS on an emergency savings initiative for their non-union employees. And Qantas Hall, who is Global Retirement Strategy Manager at UPS, was instrumental in that partnership with us. Today, we'll be talking briefly about our partnership with UPS as part of BlackRock's Emergency Savings Initiative and how we work together to implement an emergency savings program for UPS's nearly 90,000 non-union employees. Before we get into the details of that, Qantas, can you share a little bit more about your role at UPS and why this effort around supporting employees' financial well-being through emergency savings is a part of that role?
Sure, Brian. So hi, I am Qantas Hall, and I'm the Global Retirement Strategy at UPS. I have responsibility for our administration of all our defined contribution plans, to include our non-qualified plans, as well as our deferred comp plans. Additionally, I have responsibility for our financial wellness programs. And as a part of our financial wellness initiative, this particular initiative just kind of fell in my lap. And I'm happy to have worked with our partners over at Commonwealth in order to implement something like this for our employees.
And we were very happy to partner with you on it. So when you first heard about the initiative, why did you think it would be a good opportunity for UPS to participate?
Yeah, Brian, so as you mentioned, we have over 90,000 non-union employees, and we wanted an additional opportunity to support those employees. There was some data indicating that some of our employees were struggling with unexpected expenses, didn't have sufficient liquid savings, and had a substantial amount of debt. These were all issues that were important to us as an employer and a part of our overall financial wellness strategy. We additionally had the ability to get support from nonprofits with expertise in this particular area, focusing on emergency savings for low to moderate income employees. Although we didn't initially target that particular group, but we did have some substantial uptick from usage of that particular demographic.
Great. So we're going to get into the details of the intervention. I neglected to say that I would love for the audience to ask questions along the way. We'll reserve some time for questions at the end, but as we get into those details, feel free to put your questions in the chat and we'll try to address them as part of the conversation. So when you were thinking about identifying a potential intervention to support UPS employees with emergency savings, how did you go about that process of identifying what the right intervention could be?
So with support from the initiative aligned on a set of criteria to ensure we were choosing a high quality liquid savings account that met the UPS needs. We reviewed the capabilities and solutions of a number of vendors, including new third-party vendors, as well as existing vendors that we had already worked with who could potentially offer a solution. I'd say we did an informal RFP process that included interviewing a few fintech companies and a few financial institutions. We ultimately landed on a solution that worked great for our employees and great for UPS.
That's great to hear. And you mentioned aligning on a set of criteria for high quality emergency savings. From Commonwealth and the initiative's perspective, we often think of criteria like ensuring that an emergency savings solution is low or no cost, has no minimum balances, is liquid and allows for frequent withdrawals, knowing that people experience frequent unexpected expenses, is principal protected, and allows for that easy automatic savings where possible. In addition to those baseline features, which I know we were aligned on as part of that exploration of options, what were some of the most important factors and considerations, specifically from UPS's perspective, when thinking about a solution and the type of vendor that you would work with?
Yeah, and we'd agree with a lot of the points that you just mentioned there. I want to touch more on no significant cost for the employees. We really wanted our employees to focus more on savings goals and less about the cost associated with the savings. So that was a very important item for us. We had preference to work with an existing vendor if possible, given the complexity of onboarding new vendors. We have a small but mighty retirement strategy team, and ultimately our department just did not have the bandwidth to support the additional tasks with onboarding a new vendor. Consideration of the impact of the solution on our payroll team was something that really weighed on us heavily. We, again, have a small payroll team to support thousands and thousands of employees, and they just had limited capability to take on new responsibilities as well.
Got it. And those operational considerations are really critical when selecting the right solution and the right vendor. As you mentioned, you had a preference of working with an existing vendor. You ultimately, in collaboration with us, decided to utilize the in-plan after-tax account that is part of the retirement plan offered by Voya as a high-quality emergency savings option for your employees. What in particular drove that decision?
Yeah, I'd like to touch again on the limited capability to take on additional responsibilities. And again, we wanted to ensure the no to low cost solution for our participants. And the in-plan solution was a perfect option because our plan already has very low record keeping fees and very low investment management fees. So this was the perfect solution for us. After tax was also an existing feature of the plan. So this again simplified the implementation process because we did not need to do a lot of work to allow our employees to continue to defer into the source that's available, which was that after tax source. Additionally, a lot of the information related to the different contribution sources were already available on the participant website. So the back story and the back definitions of what these contributions are and how do I increase my contributions in these particular areas were already available to the employees. We had a direct link to our payroll, which allowed for automatic deductions with each paycheck. We already auto-enroll our employees at 6% on a pre-tax basis. So we have very high participation in our plan overall. Voya was an existing vendor and aligned with the goals of helping our employees to build emergency savings. So it just felt like the right fit, and it actually turned out to be a great fit.
Yeah, I just to underline a few of those points, I think that ability to do the automatic savings with each paycheck is really critical. And knowing that, the payroll team had limited capacity to add additional features, that functionality was already there. Also, just want to underline that Voya was and continues to be a really collaborative partner in helping to think through how to best utilize this existing feature. So that's great. So since this was already a feature in the plan, but in some ways underutilized and maybe not considered for emergency savings, what did you do to actually introduce this option to your employees?
Well, we work closely with our partners at Commonwealth and Voya, along with our UPS HR communication team. And we developed a robust communication campaign regarding the importance of emergency savings and the in-plan after-tax account as a high-quality option for our participants. We created a new landing page, or I'll call it a microsite. And essentially what that microsite provided was additional information related to this particular initiative. From that microsite, there was a direct link embedded within the microsite that allowed participants to review the necessary information, make a decision, and immediately act on that decision with having the ability to update their account as applicable on the participant website. We sent several emails, both from UPS and Voya. The emails from UPS, we had support from my HR communications team. The Voya communications team were supported by your team, as well as our Voya operational support team. So we had a lot of support there. We were able to communicate messaging directly into our plan communications, both digital and print. We also incorporated the messaging into our onboarding material as well as our Flex Benefits open enrollment material. We also discussed the option of after-tax through a few of our other financial wellness programs that are available at UPS today.
That's great. Sounds like it was, really integrated into existing communications, but also with new resources developed to try to, address the details and specifics of the actual solution. We got an interesting question from the audience, I think, related to this communication piece. So we mentioned that this was focused on the non-union employees. Did you see any indication that unionized employees heard about this initiative and were more curious about financial wellness resources from UPS? Did you see any kind of overlap between the communicating about this new opportunity for the non-union workers into the unionized population?
Yeah, I'd say anecdotally, no, we did not. We actually have different record keepers for our union plans and for our non-union plans. I'd say for our union plans, we do have after-tax features in those particular plans, and we do have communication that we push out regarding the after-tax, but we did not rebrand the particular after-tax sources for an emergency savings fund. But I will say that the option to contribute on an after-tax basis, pre-tax basis, and Roth 401k basis is available amongst all of our plans.
That's great. Thank you. So getting back to the rollout and implementation, so you undertook in collaboration with us and Voya this communication effort. What have you seen in terms of the overall impact of that rollout and these communication efforts?
Yeah, I think I have some stats here to share, if you don't mind. So we saw greater awareness of the after-tax option for emergency savings. 23,000 employees visited the landing page in the first year of the program. And we use the term landing page as well as the microsite interchangeably. But we had 23,000 employees to actually visit the site, which is about 25% of our participants. Over 4,000 employees have taken up the solution, which is a 39% increase since the start. And that increase is across all income ranges, not just our higher compensated employees. The majority are contributing at 2% of high or higher, which represents a 25% increase in overall plan assets, or nearly $10 million in new savings. And most importantly, we haven't seen any evidence that people are saving less in retirement, suggesting that represents an overall increase in savings for all and many employees.
That's great. And 2 points to underscore there. I think, as you noted, this was rolled out to the entire population, but obviously lower compensated employees are often going to be the ones who are in most need of emergency savings. And we've certainly seen through a number of indicators that this is reaching folks across the income spectrum, including those who may not have that emergency savings, which was part of the goal. And that point about not seeing evidence of impact on retirement savings, that's an area of concern that we've heard as well in our journeys in this space. I think more research continues to be done, needs to continue to be done on that topic, but that's a promising early indicator that people can save for both the short term and long term. And in some ways that short term savings might support long term retirement savings. So that's great. So that's a little bit of the good news and what has been positive. Any challenges around implementing the program that you would share, or cautions for employers and record keepers who are thinking about similar approaches to emergency savings?
Yeah, I would say increasing awareness and motivating employees to take action requires frequent and repeated communication. But as an employer, we need to be sensitive not to over-communicate with employees and need to balance the messaging with other priorities. Additionally, we didn't want our employees to feel like we were forcing them to make a decision one way or another. We wanted them to be comfortable with the decisions that they made as far as it relates to their own personal needs, as well as their family needs, as well as their retirement retirement goals. So it's important for us to get the message out there, and what our employees did with the message, we left it up to them. Additionally, the after-tax solution is not the ideal solution for all employees, and it could be complicated to explain the differences between it. We have a pre-tax source, we have the Roth 401k source, and in some cases, participants have been a bit confused between the Roth source as well as the after-tax because they both are deducted from the gross amount. So in that case, we've had to explain the differences between the different contribution sources. We rely heavily on our record keeper, Voya, and Voya has a customer support center, and we do have access, or our employees do have access to that support line, and they can call in and they can ask questions at any time as it relates to their individual account as well as any contribution sources. So we have the support level that we need there for any of our employees that have questions.
That's great. And that support along the way for employees who are really, navigating a set of different benefits and financial wellness offerings is really critical. And we know that it can be a challenge to choose between that array of benefits. So I think just, one final question on, this specific program overall, and then hopefully we can shift to a few audience questions. As you continue to support your employees' emergency savings needs as part of overall financial wellness, what's in store for the future? How are you thinking about continuing to do that work?
So first, I talk about a provisional update that we made to our plan last year. As a result of this particular initiative, we actually increased our after-tax contribution amount from 5% to 10% because we saw that employees were so excited about this solution and were actually utilizing the solution. We decided that it makes sense to increase the after-tax contribution amount to 10%. Additionally, we are taking a look to kind of determine the impact financially as well as how it would affect our participants on maybe deciding to match on after-tax contributions. We currently match on pre-tax and Roth 401k contributions, but with this particular initiative, and now that we're seeing an uptick in the utilization of after-tax contributions, it makes sense to explore whether or not it's a good fit for us to now match on after-tax contributions. Lastly, we are also taking a look at allowing our participants to be able to invest their after-tax contributions separately from the pre-tax contributions. So the way that our plan is set up today, the pre-tax and the after-tax contributions, they follow the same investment fund. But we like to give employees more autonomy over where they want those funds invested in. So we are exploring that option as well. So we have a few things on the table that we're thinking about as a result of this particular initiative.
That's great. Appreciate that that insight into potential, future improvements or enhancements. I think going back to the, point about having a kind of principal protected bucket for emergency savings, the ability to have different investments for the pre-tax and after taxes really critical. So thank you again for that preview. So we do have a couple of audience questions. I think maybe one related to that distinction between pre-tax and after tax. One question is on, did you have to work hard to sort of clearly distinguish the after tax as from the pre-tax in terms of the after tax being really suited for emergency savings and not just another maybe more easily accessible form of retirement savings? Sort of maybe what did you have to do to make sure that that distinction was clear?
Yeah, I won't say we had to work really hard. I'd say we had to be intentional with our messaging. We had to make sure that we had the materials properly set up where we were able to clearly define what those different contribution sources are. Additionally, we didn't want to promote, hey, if you put this money into the after-tax savings feature, you can automatically take it out. We didn't want that message to come across as, hey, this is something for you to immediately put in and grab right back out. So we definitely had to be intentional. We had to notify the employees of what they were getting themselves into. We had to notify the employees of the rules surrounding after-tax contributions, notify the employees of the rules surrounding receiving a withdrawal on those after-tax contributions. And from there, I think the education piece was very important to us. And I can say this anecdotally, we haven't seen a significant increase of withdrawals for after-tax funds. We have data that could support this, but I don't have it in front of us. So again, we were just intentional with our communication efforts.
That's great. And, I think we want to emphasize that this was the right solution for Voya or for UPS, and the kind of criteria and constraints in which you are operating, but may not be the ideal, and is certainly not the only solution for employers who are looking to address emergency savings. And I think that, complexity of the after-tax versus pre-tax is something to really consider when employers are speaking with their vendors and benefit providers about how to best solve that. I think that relates to another question that we got from the audience around other examples of emergency savings solutions and practices. So if you don't pursue a connection in the retirement plan, what might be other ways to address emergency savings, which maybe we can speak a little bit to the types of interventions that we explored in addition. So I know we talked about payroll. Payroll splitting is a functionality that many employers have that allows for easy emergency savings. But as we said earlier, in the case of UPS, the limited capacity of the payroll team, that wasn't really on the table. But we also looked at other vendors. I don't know if you can share, examples of the types of vendors or conversations we had beyond the discussions with Voya about potential solutions for emergency savings.
Yeah, I think I had mentioned a bit earlier that we had kind of an informal RFP. And through that RFP, we spoke to a few fintechs and we spoke to a few financial institutions. And to be quite honest with you, those particular vendors just weren't where we needed them to be. Either they were really early in the stages of developing a tool, or either they were really expensive, or either they had demands that we just couldn't meet, which was one of those splitting payroll files. We just didn't have the ability to take on some of that additional work. And we didn't have a huge budget for this project. So we just had to find a solution that fit for us, that worked the best for our employees, and just kind of made sense. And we have a long-standing relationship with Voya. They were great partners. They were willing to jump in and just help us out. And they did a lot of the heavy lifting along with our partners at Commonwealth. So for us, it was just kind of coming in, having some, and I don't want to downplay what we had to do from UPS, but really we had great partners. So we had to come in, we communicated, we had recurring meetings, we had to review some communication. We had a lot of data to support what we needed to do for our employees. And because Voya, again, is our record keeper, they had a lot of data that also supported what we needed for our employees. So this relationship and this partnership, it just kind of fit for us across the board.
That's great. And I think that is, really important that there are, multiple solutions out there, and you have to consider what is going to work best for, the employer, for the employee, and in the sort of broader context in which the employer is operating. Maybe one final question from the audience. So, there's a number of metrics that you can utilize to determine impact. So we've talked a few of those about just participation, savings rates, et cetera. One other metric that I think is relevant is, hardship withdrawals or loans. Is that something you're looking at as part of the evaluation of this, of reductions in loans or hardship withdrawals from the 401k plan?
Yeah, so we don't have general loans in our plan. We do follow the safe harbor rules for hardships and withdrawals. As you guys probably know, after-tax contributions are available at any time, but there are certain tax ramifications that may come up as it relates to those earnings on after-tax contributions. So that was just a piece of the pie that we had to make sure we communicated out to our employees. Additionally, there could be a penalty on withdrawing those funds if you're not of age 59 and a half. So again, those are things that we had to communicate out to our employees. But as far as making any changes to our plan as it relates to following through with the safe harbor requirements for hardships and withdrawals, we don't have any plans to do that at this time.
Got it. Got it. Great. Well, I think we are close to time. So I just want to thank you again, Qantas, for joining me and talking a little bit about our partnership. We've seen this partnership to work with UPS and Voya as their retirement plan record keeper, driving other employers and record keepers to consider how they might collaborate to address emergency savings for employees. Again, that doesn't mean necessarily that the in-plan after-tax approach is right for all employers and employees, but it demonstrates a really viable model for implementing an emergency savings solution for employees. I think it also demonstrates the potential collective benefit to frontline workers, their employers, and retirement plan providers to address this critical emergency savings need in new and innovative ways. I'll note that we will be releasing a case study in the next month or so with a bit more details on this partnership and impact to date, and we'll be sure to share that with attendees of this session. So thanks again, Qantas, and I will hand it back to the Financial Health Network.
Well, thank you, Brian and Qantas. I think by the volume of questions that came in for that session, there's a lot of interest and enthusiasm about workplace emergency savings programs. I would encourage our audience to visit the Emergency Savings Initiative website, as well as our own website, which contains valuable resources to help you navigate this space. Really excited for this last session. There's no shortage of solutions entering the marketplace seeking to improve the financial health of frontline workers. I think a critical mistake that a lot of workplaces make is they sprint towards those solutions without taking the time to truly understand and listen to the voices of their workers. The simple act of listening can, at times, feel like a lost art. It's easy to retreat behind a spreadsheet, a market survey, a dashboard, and social media, and use those as surrogates and substitutes for the voice of workers. The truth is, there's no substitute for that. The worker voice matters, and understanding how to hear and listen to workers and designing solutions that are responsive to their needs is of critical importance as we navigate solving the financial challenges of our most vulnerable. In this session, we're going to hear directly from frontline workers as they share their perspective and talk about actions that employers can take to improve their financial health, their job satisfaction, and their overall engagement. Thank you.
Good afternoon, everyone, and good morning to those of you joining us from the West Coast. Just want to thank you all for being here with us and thank Financial Health Network for hosting yet another amazing, successful, thought-provoking Emerge conference. My name is Eric Espinoza, and it's really a pleasure to have been invited to moderate this last session on behalf of my organization, Neighborhood Trust Financial Partners. So very quickly, for those of you who don't know Neighborhood Trust, we're a national nonprofit, which for the past 25 years has served workers primarily through financial coaching, helping folks avoid debt, build savings, and otherwise escape the vicious cycle that is living paycheck to paycheck. And one of the best parts about being a direct service provider is that we get to interact with some truly amazing clients. You'll meet a few of them shortly. But some of the more behind the scenes upside is what we collect in terms of extremely insightful data, which over the years we've been able to use to help our partners and customers build and advocate for safer, more equitable products and benefits. And so that broader process of data packing and collaborating is part of what we call our Worker Insights Initiative. So if at any point you find yourself wanting to hear more about that, or more from folks, rest assured, we've got plenty more to share and we'd love to hear from you. So please, you could always just email us at workerinsights@neighborhoodtrust.org. Again, that's workerinsights@neighborhoodtrust.org. Okay, so with that said, I'm really excited to say that today's session is essentially the live version of our Worker Insights initiative. So we'll be hearing directly from our clients and asking them about all the big and small things that employers can do to improve worker financial health and their overall job satisfaction and engagement. It's a brief session, so I'll do my best to keep an eye on time and also on the chat box. So please submit your questions and we'll do our best to grab a few of them and make sure that they get answered. So Cindy and Sarah, welcome. It's great to see you again. And just as a programming note, we were also going to be joined by Regina today, but she had an emergency trip to the hospital just right before our session. So we obviously wish her well, and we're really touched by the fact that she reached out to us in the middle of this emergency. So even if she's watching the session afterwards, Regina, I hope everything's well with you. I have a few things that I will mention about Regina in just a little bit, but Cindy and Sarah, I'd love to just turn it over to you. And if you wouldn't mind getting us started by introducing yourselves and telling us a little bit about the work experience you're bringing to our panel today. So why don't we go with Cindy first, and then we'll go Sarah.
Hi, everyone. Can you hear me?
Yep.
Okay. Hi, I'm Cindy. Nice to meet you. I bring a lot of wealth and knowledge and experience to this panel here. I am happy to say I'm a proud U.S. military veteran. Hi, I served my country. I have experience working with the federal government for about 10 years and working for a Native American tribal casino and jobs here and there to try to improve my situation, my family wealth and happiness. So I bring a lot of that to the table. Thank you.
Great, thanks. And Sarah?
Hello, my name is Sarah. I work for a large financial firm, Fortune 500 company. I've been in that industry for about 15 years, both on the sales side and the operations side, also a customer service focus on both sides.
Great. And then, just in absentia, I'd love to just tell you that Regina was bringing a whole host of customer service experience, and she had also been doing a lot. Well, currently I've been working as a delivery driver, and so I'll bring in a couple of quotes that she said that I could share with you all in a bit. But I'd love to kick off the broader conversation today by asking if each of you could share something that you think your employer or a previous employer might not fully understand when it comes to how your job intersects and impacts your financial life. And again, don't feel obligated to limit it to your current job. So let's switch the order and we'll go Sarah and then we'll go Cindy.
Thank you, Eric. I think that something that I would like to highlight to my employer, if I could, would be that there are several roles within our company that, although being a large company, the pay that is given to the employees, whether that be full-time or part-time, is not enough to support a family. And that a lot of my coworkers and colleagues are living below the poverty line, especially if they have children, and just how impactful that is to work for a large company, but also qualify for public assistance.
Yeah, appreciate that. And Cindy, how about you in terms of something that you feel like your employer, previous or current, might not fully understand about how your job impacts your financial life? Oh, sorry, you're on mute.
Hi, sorry about that. I'm a college graduate. When I served my country, they encourage us to go to school and to become better citizens and hopefully start a family, have your own home, the white picket fence, that whole story. And I fell for that. And when I went to college, I was under the impression that I'm going to be the first in my family to graduate. And that's a big deal because my father was born 1927. My mom was born 1936. So they come from an era where there was not a lot of opportunities. So I took advantage of every opportunity. After I graduated from high school, I joined the military. I served my country. I went to college. I graduated. And I went up to graduate school too. But I always find I was in positions where I could not get ahead. And I feel like these companies failed me. Oh, everybody would say, you can just work here. And I would work at these places, and I was proud to be working for the federal government. But I had this huge student loan debt because back then, military didn't pay 100%. They only gave you $400 a month for college. This is before 9/11. So again, I had to take all these loans because I was chasing after that dream. And in these positions I was in, I feel like I failed my family. I've been married for 22 years. I have 2 beautiful daughters. And every time I try to get ahead, I at least try to make over $15 an hour. My goodness. It was hard. And they said, oh, you need this type of education. Okay, give me tuition assistance. I can't keep taking loans out this way.
Yeah.
I'm just barely living above the poverty line.
Yeah. And Cindy, we'll get to, I remember you mentioning the tuition assistance being on the top of the list as far as some of the benefits that you really appreciated.
Yes.
And so we'll go over there in a second. And I also remember a number of the different positions that you had held over the course of your career in terms of, in terms of being a park ranger and working in different casinos, and each of those providing the same kind of obstacles that you're talking about. And one of the things that I just wanted to mention on behalf of Regina is that she, when I had spoken to her about these, this particular question, she had brought up the fact that she was a mother and is a mother of a 16-year-old, it's an 18-year-old and a 22-year-old, if I've got that right. And I know that she, in general, one thing that she brought up was just how incredibly taxing that her schedule was. And a lot of what she had to say echoed what Sarah and Cindy were just saying in terms of the broader compensation. And so if you all will bear with me, I'd love to just read a quote from Regina. She said that I wake up around 6 a.m., everybody gets ready, and we're out the door by 7 a.m. My kids have to be at school by 7:30. I drop them off and can start doing orders as early as 8 a.m. And a reminder, Regina is a delivery driver and she does a lot of orders and pickups. And so I'm at the stores doing orders from 8 a.m. to 2 p.m. I stop at 2 p.m., pick my kids up from school at 2:30 p.m. One of my sons has work, so I take him to work. The other son has football practice, so I take him to football practice. And then around 4 or 4:30, I drop him off and I go back to work. Then I pick up my son around 7 or 9, depending on, when he gets off from work. And then once I leave them home, I go back to work for the delivery apps. They take their last orders around 1:30 a.m. So I would be done and get home around 2 a.m. And then Regina, again, she echoed, some of Sarah's comments regarding compensation. In a recent conversation I had with her, she said about, whether income would make a difference. She said it really, extra income would really, really make a difference. She said, if I had the extra income coming in throughout the year, that would be big because, to be honest, I'm basically in heart failure. My doctors have told me that I shouldn't be working myself that way, carrying heavy things and running all over the place. I'm not going to say I wouldn't work if I had the extra income. There's no way I would stop working. I just wouldn't be putting myself in as much risk. I'd be able to dedicate a bit more time to strengthening myself and getting my heart healthy so that I can build up to more activity. Nowadays, I feel myself get short of breath and it makes me worried that I've pushed myself too far. So overall, I like working this job because it gives me the flexibility to do all those things. And sometimes the money's great and sometimes you run cold and it isn't great. But I'd like the flexibility to do a little less and be able to take care of my health. So with Regina's contribution I'd love to turn it back over to Sarah and Cindy and ask for some of the upsides in terms of previous employers. I was hoping if you could share some of the things that employers have done, either, practices they had or benefits they offered you that had the biggest positive impact on your financial lives. We'll go Sarah and then Cindy.
So I think one of the biggest things that I have taken advantage of with my employer that's shown an impact in my life was the ability to have a financial counselor at no cost. I started utilizing that service almost 2 years ago because I was in a very desperate financial place in my life, and I kind of figured, well, it can't hurt. So I was paired up with a financial counselor who's been my financial counselor for 2 years now. And I went from a place where I was definitely living paycheck to maybe not even the next paycheck. So I was struggling in between paychecks to a point where now I actually have money in a savings account and I'm paying debts off, which is not something that I think I could have done on my own with the projection, the way I was going. So that has made the biggest impact on my life being able to have those funds and not being worried about money every day. Obviously, making more money helps, but the ability to manage the money that we have made a huge impact for my life and for my family.
Awesome. Thanks. And Cindy, how about you?
Oh, wow. A lot has changed. Even though I work these dead-end jobs, having speak to a financial counselor has helped me realize that what are my small-term goals? What can I do to achieve financial wellness without breaking the bank, without working 2 to 3 jobs? And part of it was getting my credit card debt down, which they helped out a lot. I was able to figure out, either take on an extra job to pay down that debt or renegotiate with the credit card companies. And also at some of the companies that I work for, they offer a gym membership. So I don't have to go out and pay for a gym. They offer those kind of benefits there. Or moving into a housing situation that has a gym, so I can also work on my health too. They offer free services to the gym. So there was a lot. And when you have like a coach with you, it kind of changes your mindset a little bit. It gets to you thinking about something else, and also give you accountability too. That helps a lot. I mean, like for example, I don't mean to go off on a tangent here, but a bathroom scale gives you accountability. Are you losing weight? Are you gaining weight? With the coach or financial coach, they're giving you accountability, checking in like, okay, what have we done this month to improve your financial wellness? And hey, by the way, these are certain student loan programs that you qualify for to help get that debt down. So yes, thank you.
Yeah, awesome. No, thanks, Cindy. And one thing I'd love to just ask you guys before turning over to some questions in the chat is, if you guys had your broader magic wand as an employer, if you could just kind of rank some of the benefits that you've come into contact with over the years that have really been impactful, if you could, basically say, okay, I'm the employer, here's my menu of benefits. What would you rank at the top of that menu as what you would want to make sure that your workers had because it had the most impact on you? Sarah, maybe let's go with you. If your magic wand, what are the other top benefits that come to mind?
I know at our company, we used to have a pension program, and that is obviously something for retirement that me as an employee cannot touch while I'm employed. I know we did do away with that program, and I know that I am someone who, with a 401k, will take a loan out of my 401k. So I think the beauty of the pension is that it really does protect the employee. So I wish that was still available to me and available for more workers across the United States.
Awesome. No, that's great. And Cindy, how about you? Maybe a top item on that menu for you.
I'm always want to better myself and educate myself more on a lot of things. Sure. And definitely tuition assistance, because I don't want student loan to be a burden on anybody. I'm serious, when you get a student loan as big as mine, you can't get a house.
Yeah.
You're living apartment to apartment. And having that tuition assistance, say, look, we like you. We want you to stay with us. We want you to grow. We want you to be a part of the team. Definitely tuition assistance will be the biggest one on my list here.
Great. And then turning over to the chat, it looks like there's some questions around accrued wage products. And so what I wanted to ask each of you is sort of in a financial pinch, have either of you had access to a kind of accrued wage product where you can access your paycheck before your regular pay period cadence, or was there something else that you relied on in a financial pinch that really helped you out? Let's go, Sarah.
I go first, or just?
All right.
Okay.
I would say the official answer would be no. And I think anytime I was in that situation where I needed funds before my next paycheck, there were things that I would do to get around that, but I would not advise them to people. I don't think they're not things that you would do to better yourself. They kind of just dig you in deeper holes. So
Sure. And if I could just follow up really quickly, was there anything that you've heard of that do get offered through employers, or just that have been out there that have been, aside from tempting and damaging, but actually have helped?
no, I have not heard of any that sounded like.
Got you. And Cindy, how about you in terms of when you're in a pinch, either accessing your wages ahead of time, if that was available, does that sound like something you would take advantage of, or anything else that helped you in a pinch? And sorry, you're on mute.
Sorry about that. When I was with the federal government, I just didn't work one job. I mean, I worked at as a park ranger, I worked at one site. Let's give an example, at the Grand Canyon. Well, you know what? I got to move my family to the Grand Canyon area. And if I move up in a company, I have to relocate the whole entire family. So they're not going to pay for my moving costs because you're so bought. You're at the lower level here. So I have to go borrow money against my paycheck. And those places are called payday loans. And boy, do they charge 300, 400%. But I'm always looking out for my family.
Yeah.
Some of the companies, they will offer you like an extra $100, but they will offer you an extra paycheck so you can uproot your family to the site and start working there. So I was part of that predatory lending of payday loans. It was hard, but I paid it off because, you know, I'm always taking care of my family.
No, thanks so much for that. And then, you know, just to make sure that I circle back on the idea of accrued wages, if you had the option to say, all right, I've accrued, you know, let's say 5 days worth of pay, but I don't get paid until another 5 days from now, is that a product that you would look forward to accessing? Would that actually help you out to say, hey, let me just access those 5 days that I've accrued? Same order. Let's just go Sarah and then Cindy.
Oh, yeah.
Cindy.
I got a big mouth. Sorry.
No worries.
I would, for me personally, no. I have seen other coworkers get involved in products like that. But what ends up happening is you're living paycheck to an even further away paycheck. So for me personally, no, that was never something I was interested in.
Great. And then sort of to bring the session to a full close, Cindy, it sounded like you had a separate reaction to that.
Yes, I think it will help without interest. Yeah, everybody likes interest-free loans. Come on, who doesn't like that? But yes, if it's in order for me to get to the my goal of getting my furniture, relocating my family, the schools, a different climate, you got to buy different types of clothing. Yes, I would utilize that service in a heartbeat.
Great. And then we'll go rapid fire as we come down the home stretch here. We've got a question in the chat for Sarah, and they asked, did your employer provide you time off to be on the phone with your financial counselor?
So that's a good question. I think when this service started a few years ago, it wasn't explicitly stated. So I did typically use my time outside of work. However, because the program I think is now more common, more people use it, I now schedule some of my sessions during my workday, and I do it as part of my workday.
Great. And then the other question I've got in the chat, and I'll just toss it out, maybe just to go back to Cindy. They're asking, other than your financial counselor, are there other people in your life that you have been able to confide in and get financial advice from?
Well, because I was an Uber driver too, and I will often listen to channels like CNBC, Jim Cramer, or listen to the people who I pick up, the Uber riders, and get some advice from them. And everybody all have different advices to give me. But what I found out, what I was able to do was open up a Robinhood account, understand what stocks are, what are options. And that got me a little ahead. Like, oh, wow, I wish I was learned about this in high school or even in college. You don't learn about this stuff unless you're a business major, but not someone who's studied social services, no, social sciences, no. But so I just, I'm out there asking questions because I'm curious, because there's always people out there making more money than me.
Yeah, no, I hear that. And then the actual last question that I'll toss out to each of you, if let's say you guys were an employer, because they often say that benefits uptake can be pretty slow. And so what advice would you give to them about the benefits that they're paying for and they want their employees to take up? What advice would you give them in terms of building more awareness around their actual benefits offerings? And so we'll go in reverse order. We'll go Cindy, and then we'll go Sarah to end us.
Working for the federal government, they're very good at giving you classes about your benefits. But it's mostly if you're at the end of the line. I mean, if you're about to retire, not in the very beginning, they will always say, oh, you don't qualify. I said, well, I want to know what's my future going to be like with the government, with this organization. But no, this is for people who've done 20 plus years, and then they'll start talking about what their benefits are. So that put a sour taste in my mouth.
Got you. And Sarah, any parting words of advice for employers who want their employees to take up the benefits they're paying for?
I think Cindy hit the nail on the head. I'm very well versed in my company's benefits, but that's because I've worked in industries where sometimes I had a lot of time to read all of my emails thoroughly, to explore my company homepages.
Sure.
But not everybody has that luxury. So if they are pulled out of their work for dedicated trainings, classes, not sitting at their desk where they're still working, but trying to listen, dedicated time, or people just don't know what's out there.
Great. Awesome. That's really helpful. I think we'll wrap there. I know we're basically at time. It flew. Thank you everybody for attending, and thanks Sarah and Cindy for providing your insights and your thoughts. And we hope the rest of everybody has a great rest of your day.
Thank you.
Thank you. I learned a lot too. Thank you.
Take care.
Welcome back, everyone. It is not common that I am speechless for those who know me, but I have to say that panel left me somewhat speechless. It was remarkable. Very thankful for Eric, and a huge thanks to Cindy and Sarah and Regina. We hope everything's okay. Your humanity, your dignity, your voice, that matters the most in these conversations. So I'm just so thankful we had a chance to just present that, because it's so powerful. It's so important. Beth, would love to hear, as I'm going to remain speechless, would love to hear, some key takeaways you had, and any other insights you want to share with the audience.
Yeah, thanks, Matt. I've just, I just likewise just feel really blown away by that last conversation and all the conversations we've had today. I think there's a couple of things that really stood out to me. The importance of listening to workers. And I think we heard this from our first session around equity, that hearing from business resource groups and employee resource groups is an important part of the way in which companies can understand the needs of different segments. And I think we heard that loud and clear in this last segment, that workers want to be heard. And it's important to go back to workers and let them know that you've heard them, you've listened to them, and take an action based on what you've heard. And the other thing that really stood out to me is seeing the that there are so many more tools, more and more tools are available to help employers on this journey, like living wage tools, like the ones provided by Good Jobs Institute or Living Wage for Us, and communities of practice, like the ones that have grown up around the Emergency Savings Initiative or the Worker Financial Wellness Initiative. It gives me a lot of hope for the future.
Absolutely. We thank everyone for joining us today. A few quick announcements before we go. Big thanks to our sponsors. None of this is possible without your generosity. Also wanted to give a big thanks to our Emerge and events team. All of this is not possible without their tireless support and effort. So Julie, Fazia, Chris, Greg, Misha, Stacy, Lindsay, Xandra, Melanie, and the many other folks at FHN and outside that really helped bring this together. We hope to continue this conversation, so mark for your calendars, Emerge Financial Health event, September 21st to the 23rd in Los Angeles. Thanks again for joining us today, and we look forward to our continued partnership and mutual support.